Thank you for joining us here today. We're pleased to welcome Congressman Chris Pappas as part of Dartmouth-Hitchcock Health's We Care, We Vote initiative. We Care, We Vote is a nonpartisan voter education initiative designed to educate and empower Dartmouth-Hitchcock and Dartmouth-Hitchcock Health employees to participate in the electoral process by voting in the 2020 elections. All candidates for federal and statewide office have been invited to participate. So look for opportunities to hear from others in the upcoming weeks. Chris Pappas is running for a second term representing the 1st District of New Hampshire, which is home to a number of our community group practices. Congressman Pappas is from Manchester, a graduate of Harvard University and a 4th generation owner of the Puritan Backroom. Prior to his service in Congress, Representative Pappas served on the New Hampshire Executive Council in the New Hampshire House of Representatives and as Hillsborough County Treasurer. We look forward to hearing from Representative Pappas for some short remarks, and then we'll open it up to questions from the participants. As you listen, please submit questions in the chat function. You might hear the beep as things come through. Representative Pappas, you'll hear a beep on my computer screen when the questions come through. So take it away.
Well, thanks very much, Dr. Hoffley, for the introduction. I want to thank everyone for tuning in, and I'm really grateful that Dartmouth-Hitchcock would create this virtual forum for members of the community to get together and talk about the issues that are important in this campaign and talk about the need for everyone to get out and safely vote on November 3rd. There's a lot that's at stake in this election. I think the future of healthcare as we know it is on the ballot in November. The experience that we have all been through these last few months has been really trying. We are in a period of national crisis right now. We have lost more than 210,000 Americans to COVID-19 and 450 granite staters. We know that more work needs to be done to stay vigilant, to sustain our efforts, to make sure that we're doing all we can to respond to the virus and to save lives. And I just want to thank all of our frontline healthcare workers, everyone who's part of the Dartmouth-Hitchcock community for the compassionate care that you've been offering the people of New Hampshire, for the way that you've been working with the state of New Hampshire and helping to ramp up testing. It has really helped make a difference in the overall picture here in New Hampshire. But of course, we know we need to continue to listen to those public health messages, to do our own part to keep our community safe and to keep our numbers low. I've had great concern from the get-go about the impacts of COVID-19, not just on the people of New Hampshire, but on the overall health of our state. And we've got to do more to support our healthcare system, including direct support to our hospitals and community health centers who are struggling financially right now, and to make sure that we're providing the right care that people need at the right time. I also fundamentally believe that we need to move past the political divisive conversation we've seen around the Affordable Care Act and to talk about fundamentally how can we improve healthcare, make sure that it's better integrated, and work on bringing down costs. And I think that involves a conversation where providers have a stake, patients have a stake, and we have to be working hand in glove with policymakers at the state and federal level to make sure that we can move forward. I want to stop the effort to blow up the Affordable Care Act. I think we need to build on it, to seek out more choice and competition in the marketplace, and ensure that more people have access to care that works for them. So I really just want to thank Dartmouth-Hitchcock for the work that you do all across our state. I'm really excited about the combination that's been proposed with CMC, and I really look forward to discussing the future of healthcare and how I might be responding to these issues in Washington over the next couple of years.
Well, thank you. You've answered some of my questions already. You're making it tricky for me. So Dartmouth-Hitchcock, as you said, has really been at the front line of the COVID-19 response here in New Hampshire and the region. And the pandemic, unfortunately, has greatly impacted our fiscal health, care delivery, and the communities that we serve. What steps will you take to assist the fiscal recovery of hospitals in New Hampshire?
Well, that is vitally important. And I know, hospitals have faced tremendous financial pressures over a lot of years. So many entered the COVID experience without being flush with cash. And they were very concerned about the loss of revenue generating services that sustain their operations. So the support that we gave to hospitals through the CARES Act was an important step forward. But I believe we need additional COVID relief legislation that can continue to provide the support that's necessary over the fall and winter months to make sure that our hospitals are on a solid financial footing, that they're able to address not only the COVID needs, but all the health needs of people across our state. So I'm advocating for additional direct financial resources to hospitals, to community health centers and providers who are being hurt by this. And I think that's one step that we can take to help address that picture. Of course, we've got to get a compromise to get something over the finish line. And what's been really frustrating is it's been more than 4 months since we passed the HEROES Act in the House back in May. We just passed another version of the HEROES Act last week, but we haven't seen the sort of bipartisan compromise come together that is going to allow us to get something over the finish line. So my thought is, let's lock everyone in the same room and not let anyone leave until we get a deal done. This is so important. I think most have the understanding that the fall and winter months are going to be very difficult, and we run the risk of COVID staging a resurgence here in New Hampshire and across the country. We can't afford to have that happen, both for the health and economic well-being of this country. We have to make sure our hospitals have the resources that they need financially. And so that direct support would be really vital. And I hope we can get something over the finish line soon.
Well, we're rooting for you. So, so the next question people talk about is, coming out the other side of this with COVID, a vaccine. So how will you ensure a robust supply chain of medical supplies and a potential vaccine when available?
Well, thanks for the question. I think taking a step back, we all realize the way that we are too dependent on foreign sources for the supplies we need right here to make sure that we have the PPE necessary to keep people safe, but also as we think about ramping up the deployment of a vaccine, that we have all the supplies we need. I think we need to, on a longer term basis, look at fully deploying the Defense Production Act and making sure that we're making more of these supplies right here in the United States. If we're using our tax dollars, we should be focused on how we can put people to work here to ramp up manufacturing domestically, because this is not only a health issue, it's a national security issue. And we've got to make sure that we have independence when it comes to some of the supply chains that have been interrupted as a result of COVID. Of course, we all hope that a vaccine is going to be there. And I know there are some promising stage 3 trials going on right now. We're all rooting for that to be as, approved as swiftly and effectively as it possibly can. But of course, we can't put all our eggs in that basket, but we have to be building for that day when and if it becomes available. And that means having federal resources that can help build out the public health strategy on this, bringing the provider community to the table, ensuring that we're working with our state public health departments and public health networks and the private sector to really ensure that we're getting this vaccine where it needs to go as quickly as possible. Of course, our vulnerable citizens, those with chronic conditions, our frontline workers and first responders, we've got to make sure that our vulnerable groups and those who need it most are prioritized. But we do need a national strategy on this, just like we continue to need a more robust strategy around testing nationally. And that involves how we can get our hands on the supplies we need to move forward. So more domestic production, we've got to incentivize that through our tax code and our federal outlays. And we've got to make sure that we are preparing for the eventuality of a vaccine being available. And we hope it gets here as quickly as possible.
Yes, it's certainly going to take all of us working together as a team to get this, going. Sort of shifting a little bit from a national strategy to what steps would you take to address the needs of our communities here in New Hampshire during the pandemic?
Well, thanks for the question. And this is first and foremost a pandemic and a public health crisis, but it has spawned an economic crisis that is impacting people all across our state. We see the numbers that are really alarming, the number of people who are out of work or who are working fewer hours. We have a third of residents across the country who missed a housing payment last month. So we know there's great financial pressure on our families. And we've got to make sure we're meeting those needs. And that's why I support additional assistance to individuals to make sure that they can stay in their apartments, that they don't default on their mortgages or student loans, and to ensure that we're providing some additional support for people who are out of work through no fault of their own right now and can't safely return. We need to do more with childcare. That is a barrier for folks to be able to return to work. And so we've got to look at the whole health of our families from a financial perspective to make sure that their needs are met. What I'm really concerned about is the number of individuals being disconnected from their health insurance. I think we have more than 10 million individuals across the country who have lost health insurance over this time period. We know that if someone had it through their employer, they lose their job, that COBRA is cost prohibitive. So that's why in an additional relief bill, we need to see strong support either for individuals to stay on COBRA or to provide an open enrollment period for them to get healthcare on the exchange and provide the adequate subsidies so that healthcare is affordable to them. So I think we have to look both at the financial health of our families and also their ability to stay covered because this is an important time where we can't see an interruption in insurance.
You got one. That was one of my next questions. All about health insurance coverage. I wanted to remind everyone who's on the chat today to please send in the questions that you have. I have a long list of questions, although you're getting ahead of me on some of them.
Okay.
Congressman.
I'll try to take
all
them
good. It's all good. It's all good.
Okay.
But if anyone else has any questions, please send it through the chat box and we'll make sure we get them to Congressman Pappas. The next question I have is the waivers and flexibilities that were put into place by HHS and CMS during the public health crisis removed a lot of regulatory barriers, enabled providers here at Dartmouth-Hitchcock Health to provide more patient-centered care. Specifically, we enhanced our telehealth services to provide care to patients at home. What steps will you take to ensure that Medicare continues to cover telehealth services to patients in their home? And also, as you know, a significant portion of the population of New Hampshire doesn't actually have access to broadband, or it does have access but can't afford it. What efforts will you make to ensure that audio-only visits continue to be covered even after the public health emergency's passed?
Well, thanks very much for that question. I think that's an important one. And I've had the opportunity to come up to Lebanon and to take a look around the facility. And one of the things that impressed me the most was the Telehealth Center. And so Dartmouth-Hitchcock is doing some great work, and prior to the pandemic was doing some great work at building out a way to continue to serve patients, especially in rural areas and underserved areas of our state. And so I think that this transition that is happening is one that we have to ensure continues to stay with us even after COVID. And that means changing the rules on a permanent basis at CMS and making sure that the support is there in the law to usher in this transition. Now we've got to make sure that we're just not looking at, that we're looking at all forms of telehealth, including audio only services. I think that's critically important. And we also should be looking at how we can make sure that technology is there in the hands of the individuals so they can have access to this really life-changing and life-saving technology. That means making sure that we have more support to build out broadband. Really, I look at broadband the same way as we would have viewed electrification of rural areas at the beginning of the last century. It's a must for our businesses to get access to services, for education, and certainly for healthcare. That's why we passed an infrastructure bill in the House a few months back that included $100 billion for broadband. I'm hopeful if we see a COVID deal, it could include broadband. But I think as we think longer term about how we put people back to work and rebuild this country, broadband has got to be a key component of that. Too many of our communities are shut out because of geography, and too many of our families are shut out because of socioeconomic reasons. So we have to make sure it's affordable, that the technology is there, it's accessible in order for all users to be able to connect this way. But there is legislation out there that I support. One bill is called the Connect Act, which would improve Medicare coverage of telehealth services. And we'll really look at all legislation that's on the table and all vehicles to make sure we're moving us in the right direction. This is really the wave of the future. I've been hearing some encouraging things about how people who didn't necessarily think the telehealth was going to work for them were really surprised about how they were able to have a great visit with their provider and how it met their needs. So I think this continues to be an area where we need to see innovation and development, and where the federal government has a role to play in encouraging that.
Well, thank you. So switching a little bit, so many of Dartmouth-Hitchcock's patients rely on Medicare as their source of health insurance. In the September 2020 budget outlook, the Congressional Budget Office predicted that the Medicare Hospital Insurance Trust Fund will be unable to fulfill its commitments by 2024, sooner than previously predicted. If you're reelected to the federal office, what will you do to ensure that Medicare is available and that all seniors will be able to access the medical care they need?
Well, thanks for that question. And Medicare is a foundational program. We have to make sure that it's strong, both for today's enrollees as well as people who are looking forward to one day being a part of the Medicare system. It's an important part of our overall healthcare system, so we have to make sure that Medicare is strong. So, budgets are statements of priorities, and we have to ensure that, the allocations and federal support that's going to Medicare remain strong, and that we're able to deal with some of these solvency issues. It's a top priority of mine. I think we're all appreciating throughout this pandemic the way that all of our health is connected, and that making sure that people are healthy or getting the right care is really critically important. Now, there are a number of things in the Medicare space that we can talk about, and maybe we'll get there with some of your future questions. Certainly, telehealth is one issue. We want to make sure that Medicare has approval for telehealth. In addition to that, there's a lot of conversation around drug pricing, and we recently passed a bill that would, negotiate drug prices with the pharmaceutical companies under Medicare and achieve great savings. So I think as we think of the program holistically, there are a lot of things we can do to improve it, to improve coverage of certain things that aren't covered right now, and to make sure that it's solvent for the future. And that's really my commitment to our seniors and those who are on Medicare today.
Great. So, we talked a little bit about vaccine and the future of vaccine, but a lot of that work came out of research. Research at Dartmouth-Hitchcock, researchers here are proud to be recipients of a lot of federally supported research grant programs, including from the National Institute of Health, the Agency for Healthcare Research and Quality, Center for Disease Control, and Patient-Centered Outcomes Research Institute. Will you be an active champion at the federal level to ensure there's robust federal funding available for medical research?
Absolutely, and I have been through the appropriations process over the last couple of years. And I'll continue to be, because I look at these as smart investments, ways that we can use our tax dollars to help unlock advancements and breakthroughs that can save and change lives. And so the work that's happened at Dartmouth has been exciting to hear about through this pandemic. And I know it goes well beyond COVID in terms of the research that you're being done. So I look at this as a way to, not only help patients across the country and around the world, but to bring some dollars back here to research institutions in New Hampshire, that can help bolster our economy and really ensure that our state continues to be a place where we can innovate. So I think there continues to be some exciting potentials there, and we'll do all we can to advocate for research dollars. I know that, in terms of the COVID relief packages that we've passed 4 major bipartisan COVID packages already that were signed into law. They included significant support for research. The bill that we passed last week, the updated HEROES Act, also includes about $28 billion for research. So we know that, as we're seeing a novel virus today, research is so important to understand it, to know how we can treat it, to know how it's communicated, and to know how we can put it in the rearview mirror. But we do have to make sure that we're sustaining these efforts to look at a range of threats and challenges that we face in a variety of different areas. And so I really hope we can continue to do that. And Dartmouth is a place where it's going to happen.
Yeah, that's great. When I think about it, I like the concept COVID in the rearview mirror. That's nice, but we have lots of other challenges. We still need to participate in research. So New Hampshire is bracing itself for what we call the silver tsunami. Baby boomers age and leave our workforce. It's going to be imperative for New Hampshire to attract and retain young professionals, not just in healthcare, but across all sectors. How will you work to attract and retain young professionals and their families to New Hampshire?
Well, we do have a demographic challenge. We're the second oldest state in the nation. And unfortunately, too often the cost of college is prohibitive for many of the young people who grow up in New Hampshire, who we would like to retain here, have them go to school here and start their careers here. So I think we have to look at affordability around higher education in New Hampshire to make sure that it's within reach of more individuals, and work to create partnerships between our universities and the private sector to make sure we're building pipelines right into the workforce here in New Hampshire as a way to retain some of the young talent that is part of who we are here in New Hampshire. In addition to that, I think we have to look at our healthcare workforce and how we can support the needs of our workforce over the long term. I've supported efforts to focus on our primary care and nursing workforce to make sure that we're reauthorizing programs in Congress that can help, put professionals in the right place where we need them in our healthcare system in New Hampshire. I support training programs, especially for our SUD workforce. And I think we've got to look at making sure that we're using loan repayment programs as a way to, attract the talent we need here in New Hampshire and allow professionals to deal with a mountain of debt that they've taken on to go through school and to, pursue something that they're passionate about. So I think there are a number of fronts we can work on here, but creating partnerships, dealing with the cost of college, and supporting and expanding existing programs, to get providers into parts of the state where we really need them are going to be ways that we can address these challenges moving forward. I think, in addition to that, young people want communities with amenities, and we need to look at making New Hampshire an even more attractive place for young people to call home. I've been doing some work on transportation and infrastructure about how we can create an intermodal system of transportation with expanded rail service in New Hampshire, with more opportunities to build out the bike and pedestrian infrastructure that we have across our state to really make sure that this is an attractive place for people of all generations and that you can get from point A to point B. So I think that's part of the conversation too about how we really create a dynamic future for our state that attracts a lot of the young professionals we need.
Well, I hope working together we can do that. I certainly hope. I'm one of those baby boomers, and I hope we can convince my kids to come back and live here. We do have a question from one of our viewers.
Sure.
They say, do you believe that the COVID-19 pandemic and subsequent crisis of 5.4 million people losing employer-based health insurance makes it abundantly clear that the current system of care is not working for everybody, and a Medicare for all system is needed?
Well, I think it's very clear that when your health insurance is tied to your place of employment, that there are limitations on your ability to move freely about our economy, and there are interruptions that come about when a job is lost. And so I think we need to look for ways to make sure that we're paying attention to those transitions and to allow people to have insurance coverage that is portable. I do support allowing additional options for folks, especially a Medicare-like option on our health exchanges. And I think we should look at more flexibility and more ability of individuals to, have enrollment in healthcare when they need it. And so we see a lot of folks being displaced from their job today, and it's deeply concerning. Healthcare should really be a right and not a privilege in this country. And I think we all have to work toward the goal of universal coverage, because when everyone's covered, not only is that the humane thing to do, but it is also the economic thing to do, especially over the long term. We want people to get the primary care that they need, to be focusing on prevention and wellness. If we do that, the individual is going to live a longer, healthier, more productive life. And we're also going to save a lot of money, especially in programs like Medicare over the long term.
Well, it is 8:30. So Congressman Pappas, I wanted to really thank you for spending time with us today and sharing with us your ideas, both about how we're going to handle the pandemic and the aftermath of it, but also all the things you're working to do here in the state. So good luck in the next few months in Washington. And thank you so much for spending time with us today. Really appreciate it.
Well, thanks very much, Dr. Hoffley. Thank you, everyone, for tuning in. And I hope everyone gets out and votes on November 3rd. This is a point in time where we need to hear from everyone, and we need to hear what's on your minds, and also make sure your voice is heard safely in this election. So thanks very much for all you do, and everyone stay safe.
Well, thank you. And everybody out and vote on November 3rd.